start the whole FDNY initiative, or you just want me to get into the kit
A
itself?
1-minute spiel.
You know, starting from January 1st, there's the whole FDNY initiative, bringing status post-cardiac arrest patients to facilities that can actually continue hypothermia. And then starting in April, they're going to be administering the cold saline, 4 degrees Celsius cold saline at 30 to 40 degrees, 30 to 40 cc's per kilogram bolus in the field. So probably like a 2-liter bolus of cold saline at 4 degrees Celsius is going to be administered in the field for any patient who meets criteria. And then they're going to take it to a facility that can actually continue the cooling. So in your facility, I guess you may be inserting these triple lumen catheters here. The only thing that we were discussing is you want more of a controlled situation because you are putting in a femoral line. When you open up the kit, it will come with a ChloroPrep, which I don't have in here now. It also has a bio patch as well. So it is your regular standard triple lumen kit. You have your drape, you have your gauze, you do have your scalpel. You have 2 guide wires. Reason being, if you drop one, you have an extra one. You don't have to open up another $600 kit to get one. Okay. You have your syringe for your lidocaine. You have lidocaine here. You have your suture. 10 French dilator. This catheter is a 9.3 French catheter. Okay, so basically, as you're inserting, you're going to prep your site. You're going to anesthetize the area. Then you're going to try and get your access, as you would normally, into the femoral. Once you have your access, you want to thread your guide wire. Okay, so you would just thread your guide wire as you would normally. You know, remove the needle holding onto the guide wire. You want to then dilate with your 10 French dilator. You may want to put a little nick into skin prior to that. Dilate fairly aggressively because you are going up to a 9.3 French catheter from the guide wire. Okay. Once you insert over, you want to just remove the cap from the distal port and then just thread it over the guide wire. Insert. When you're inserting, the only thing that you do want to watch for is, unlike a regular triple lumen, you don't want to do a twisting motion if you meet resistance. If you do meet resistance, you want to just use constant pressure and continue to just push through. Reason being is that when the saline is flowing through the closed loop circuit, if you twist it and the catheter is twisted, it would impede the flow of the saline through the catheter itself. Okay, and you would see that. So you just want to make sure you maintain constant pressure. Sometimes when you get as far, you have 3 balloons here, but it'll come very tightly packed. There's a protective cover over this when you open up the kit. You want to make sure you keep that protective cover on right before you go to thread the catheter. You don't want any of the sharps in the kit to nick any of the balloons and cause a rupture. Okay. So you've threaded it over, and you basically have your proximal, medial, and distal ports like you would any other triple lumen. These 2 teal ports, which will be labeled not for human use, are to attach to the machine. Once they're attached to the machine, cold saline will be delivered through them in a closed loop circuit. These balloons will inflate to about 40% of the real estate inside the IVC, and there's going to be a temperature exchange when the blood passes over the catheter itself. You know, if the patient needs to go to CAT scan, MRI, it is CAT scan and MRI compatible. You would simply just close these off like that, just so that no one will be able to use it. You could use this triple lumen like any other triple lumen. Any contraindication is that if you are delivering the cold therapy, mannitol would crystallize in this catheter. So you would want to just use that in another, or use hypertonic solution, something else. But it would crystallize. And these are tested to about 100 PCIs of pressure, and your power injectors, if they need to go for a CT angio, are about 300, so it would rupture the catheter itself. So you want to If they need a CT angio, you want to make sure that they infuse the dye through a separate port as well. Okay. Do you guys have pressurized triple lumens here? Catheters or picks?
No.
So then you would use it just like you would any triple lumen in your facility. Okay. It does come with a bio patch as well and an inclusive dressing. They're not in the kit, but any questions about?
Explain one more time what this plastic coating is.
Okay. This is basically, if I had the machine here, what happens is when the saline goes through, these balloons are going to inflate. Yeah. There's 3 balloons, which is giving you the surface area that you're going to need for the cooling process. It's going to get really cold. It can go down to as low as 0.5 degrees Celsius. And you're going to see that it would inflate, and you know, it sits basically here. It takes up about 40%, 38% of the IBC, and that's on a small woman. So these actually, when you take it out of the package, it would be packed very tightly with a protective cover over it. It's just that this is the demo and it's a little bit loose. Any other questions?
So one balloon is for the filter bearing, and one balloon for the bearing.
Yes. What's a port? Yeah. You have an in and an outflow port. It's labeled in, this one's out.
Can that be placed anywhere? Any site?
This? No. Femoral. Only femoral. We do have a subclavian and an IJ catheter, but it does not have the surface area required to induce hypothermia. It's strictly not big enough. You know, it only comes with 2 balloons, and it's more of a fever control catheter for like a neuro patient with, you know, TBIs, strokes. It's more for fever control. We have a 3 balloon and a 4 balloon catheter that has this can cool up to 1.5 to 2 degrees Celsius an hour. You know, with all your other adjunctive therapies. So you really need, when you're trying to cool as quickly as possible, you need something with, you know, a lot of power and that can do the job fairly quickly. Any other questions? Pardon?
When we put it in, drug cultures on
You could, yeah. And it is good to, I know with all the blood work, I don't know how your protocol is, but we always, in our facility, we always draw 2 blood cultures, one off a separate site, just because all your physiological signs of SIRS and sepsis are going to be masked with the cooling process. So you want to make sure you have something cooling, you know, with aspiration pneumonia. We also give them unison or Zolson, you know, just prophylactically, and then we get a chest x-ray in 3 days. If it's clear, we just stop the therapy. And, you know, if they do have a pneumonia, we've already been giving them antibiotic therapy.
Besides mannitol, any other medication that can crystallize?
No, just mannitol is the only contraindication. Otherwise, you would use it just like any other medication, triple lumen. Yeah.
So where can we view the video?
YouTube. I'll send you guys the link.